just to give people an idea of how much pressure. So Sadiq Khan, the mayor of London, came out and said, which is something we've spoken about before, is that usually there are about 5,000 calls to 999, and at the moment they're seeing calls around 8,000 to 9,000 calls a day, which is almost double on some days. So when should someone call 999, and what are the different options that people can do if they don't need to call 999?
So 999 is, again, 999 is there for your emergency and urgent care needs. So should you have difficulty in breathing, should you have chest pain, should someone be unconscious or fitting, or have a really urgent or emergency need, you've broken your leg and can't move, those sort of situations, absolutely, like they are, call 999. A lot of the time you can get advice via pharmacists. Pharmacists are really good at sort of, if you just generally don't feel great, have a question about a medication you could take, have a question about a minor injury or minor illness. Actually, pharmacists are really, really good. They can provide sort of care advice and self-care advice for you. You have NHS 111, both online and on the phone. Online, we'll go through a bunch of symptom checkers, and then it will sort of guide you about sort of what options you have available to you. And then you can obviously call up 111 as well, and you can speak to clinicians over the phone. So there's quite a few options. At the moment, people always forget their own GP. So your own GP, they are still open, and a lot of them have extended their hours. So if it's during the hours and it's not an emergency 999 need, call your GP. Make sure that you let them know that this is what's going on, and they can try and either book you an appointment on the same day or for a day or two after, because they're doing lots of phones sort of assessments by telephone now. So they will go through a whole heap of sort of questions with you. But yeah, reserve 999 really for those that really, really need it. Try and self-care or use 111 where it's sort of a lot more minor. And also just think, sometimes what will an ambulance do for you? If there is sort of the ambulance is not going to do anything for you, remember the ambulance is not a taxi. It costs a lot of money and it's a lot of resource to remove the ambulance for something like a broken fingernail, a cat scratch. These are genuine examples I'm giving. That you have. I don't want to say called incorrectly, but is an ambulance required for that? Probably not. Could you make your way to an urgent care centre or walk-in centre? Probably. Could someone drive you there? Absolutely. Could you get a taxi there? An ambulance, as much as it might look like a big yellow taxi, it's not. We have life-saving equipment on there, so it should be reserved for those people that really, really do need it.